A few months ago, I was asked to see a patient to see if he was going to need chronic and ongoing dialysis. The patient had been seen in the emergency room and was found to have new onset of kidney failure. He was told by the doctors in the hospital that he was going to need to be on dialysis for the rest of his life. He told them he did not want in any circumstance to start dialysis, so they discharged him home and he had a follow-up visit with me. Unfortunately, there were a lot of barriers to him getting adequate care in the hospital and a lot of difficulty for him understanding what does dialysis mean, what will it mean for the rest of his life. And unfortunately, because English was not his first language, there was a lot of confusion over what had happened when he was hospitalized. He came to see me in the clinic and we spoke a lot. We spent probably about an hour talking about what is dialysis, what does it mean, what's the lifestyle like of people who are on dialysis, and we talked a lot about kidney failures and all the different options to replace your kidney function when your kidneys no longer work. These options include 2 different types of dialysis as well as kidney transplantation. I saw him a few weeks later. He had time to think it over. We had a second discussion, again, about the types of kidney replacement therapy. What does it mean to be on dialysis? He asked a lot of questions. Our team here at Central Health consists of myself, a nephrologist, but then we also have a nutritionist, a social worker, a community health worker who provides dialysis education and chronic kidney disease education. In between the first visit and the second visit with me, he saw our entire team, was able to speak to everybody, learn about what are the things he can do in his life that will affect his progression of kidney disease, improve his lifestyle, whether he is or is not on dialysis. He was able to learn more about the modalities of kidney dialysis and also learn more about the potential for kidney transplantation. By the time he had his third visit with me, he'd actually researched types of dialysis on his own and was actually excited to start. He'd talked to friends who'd been on dialysis. He'd talked to our community health worker and had more education. He'd spoken to our nutritionist and had a health plan and things he was eating and not wanting to eat to improve his health. And I think we took a patient who was, unfortunately, after his hospital discharge, completely depressed, not wanting to go on, not wanting to do any medical treatments that would be life-saving, and suddenly he kind of had a new outlook on life. He's going to be enrolled in our transitional dialysis program. We're going to find a way for him to do dialysis on his terms now that he understands more about the procedure. And hopefully, when he's able to enroll in some of our other programs, he may even have the possibility of kidney transplant in his future.